Hello everyone, in this video we'll demonstrate the correct positioning of two important surgical positions, the knee chest and the jackknife position. These positions are commonly used in procedures involving the perianal region and the lower rectum. And now let's get started. So the first position is the knee chest position. In this procedure, you will learn how to position and drape the patient for examination of the back and rectum and for certain surgical procedures. First, greet and introduce yourself to the patient.
Good afternoon, sir. My name is Erica, Dr. Agana's medical assistant. Before we get started, can I get your name and your date of birth?
Sure. My name is Isan Mokipata. I was born in March 1, 2003.
Then, confirm the patient's identity using her name and date of birth. Then, sanitize your hands.
So, Dr. Aganas is going to perform a rectal exam today.
Explain the procedure to be performed in a manner that is understood by the patient. Answer any questions the patient may have about the procedure.
So, you're going to have a slightly uncomfortable position, but I'll help you to get the correct position in this exam.
But before we can do that, depending on the provider's preference, the patient may be instructed to completely undress and put on a gown so that it opens in the back, or to add or to just undress from the waist down. Tell the patient that the gown should be open in the back.
But before we do that, I'm going to have you undress and put the gown on in the open and down the back.
Then provide assistance as needed.
Do you need any assistance?
No, I'll be fine.
Good. I'll give you some privacy.
Give the patient privacy while changing. Knock on the examination room door before re-entering to make sure the patient has completed undressing and gowning.
You may come in.
Hi, Mr. Pata. How are you doing today?
Do not place the patient in the knee chest position until the provider is ready for that part of the examination.
Okay, we're ready to start the exam. Erica, can you please get him into the correct position?
Sure.
Pull out the table extension. Help the patient lie down on his back. And then have him turn over into the prone position. Ask the patient to raise himself onto his knees. Spread his knees apart and lean forward onto the head so that the patient's buttocks are raised. Tell the patient to keep his back straight and turn his face to one side. The patient should rest his weight on his chest and shoulders. If the patient has difficulty maintaining this position, an alternative is to place weight on his bent elbows with his head off the table. To provide him with warmth and privacy, drape the patient diagonally so that the point of the drape is on the table between the legs. After the examination has been completed, assist the patient as needed to get off the table and get dressed. So the next position is the jackknife position, or also known as the Kresge position. The patient is positioned in their abdomen with the hips flexed and the knees fully bent. This position is commonly used for surgical procedures involving the perianal region or lower rectum, such as hemorrhoidectomy, fistulotomy, or examination of the rectum. And now let's proceed to the preparation. So ensure that the operating table is appropriately padded to prevent pressure sores and have the necessary surgical instruments and equipment ready. Next is the patient positioning. So the patient is placed on the operating table in a prone position. The table is flexed at the level of the hips, causing the patient's abdomen to hang freely over the edge of the table. The degree of flexion depends on the surgical needs. The patient's legs are bent at the knees, with the thighs angled upward and the lower legs hanging off the end of the table. The degree of knee flexion can vary based on the patient's anatomy and the surgical requirements. Ensure that the patient's arms are positioned comfortably, either alongside the body or on arm boards, based on the surgical needs and the patient's comfort. Next is the adjustments and safety. Ensure that the patient's head is positioned in a way that allows for easy breathing and access to the surgical site. Use padding under the patient's chest and pelvis to provide comfort and prevent pressure sores. Monitor the patient closely throughout the procedure for any signs of discomfort, respiratory distress, or nerve compression. Once the patient is properly positioned, the surgical team can proceed with the planned procedure, taking advantage of the exposure provided by the jackknife position. The surgeon can access the perianal region or lower rectum with ease due to the flex position of the hips and knees. After the procedure is completed, the patient is carefully repositioned to a more comfortable position. Monitor the patient for any post-operative complications related to the positioning, such as pressure ulcers or nerve injuries. And that's all for today. Thank you.